Hello, I'm Dr. Averett, the Medical Director of Adult and Family Medicine at Legacy Community Health. I'm going to talk today about why it's important to get vaccinated against COVID-19, what is the Delta variant, and other questions people want answered about the vaccine. How do we know that the COVID vaccines are safe? We know a lot of y'all have questions about vaccine safety. The COVID-19 vaccines were developed using science that has been around for a really long time. The COVID-19 vaccines are not experimental. They went through all the required steps of clinical trials, all the testing and monitoring required before a vaccine can be used. The trials clearly show that these vaccines are safe and help protect people against COVID-19. Recently, the Pfizer COVID-19 vaccine was approved by the FDA for individuals 16 years of age and older. But the vaccine continues to be available under its current Emergency Use Act for children ages 12 to 15. This further proves that these vaccines are safe and effective. Are the side effects of the COVID-19 vaccine the same or worse than getting COVID-19? Results from vaccine safety monitoring efforts are very reassuring. The known and potential benefits of COVID-19 vaccination far outweigh the known and potential risks of those vaccines. Some of the most common side effects of the COVID-19 vaccine are fatigue, muscle aches, arm soreness, maybe a mild fever, some mild nausea, but nowhere near as extreme as what we've seen with individuals who have COVID-19 disease. To date, the systems that track the safety of the vaccines have found only 2 serious types of health problems after vaccination, both of which are very rare. A small number of people had severe allergic reactions or anaphylaxis to the vaccination, but again, I can't emphasize how rare this is. Anaphylaxis can occur after any vaccination and is very treatable. It's for that same reason that patients are monitored for 15 to 30 minutes after receiving the vaccination to make sure that no severe allergic reaction is caused. And if so, the medical personnel are present in order to act and help that patient. Another serious side effect from one of the vaccines, the Johnson & Johnson vaccine, was blood clots in a certain population of young women. As you all know, the distribution and administration of that Johnson & Johnson vaccine was put on hold while the side effect was further investigated. And since it has been found to be safe in many patient populations, and discussion with your provider should be encouraged before you receive the Johnson & Johnson vaccine. There are also recent reports of myocarditis and pericarditis in adolescents and young adults after the COVID-19 vaccination. The known and potential benefits of COVID-19 vaccination, again, outweigh the known and potential risks. So we continue to recommend the COVID-19 vaccine for anyone ages 12 and older. True or false? You can get COVID-19 from the vaccine. This is definitely false. None of the authorized COVID-19 vaccines in the United States contain any live virus that causes COVID-19. This means that a COVID-19 vaccine cannot give you COVID. COVID-19 vaccines teach our immune systems how to recognize and fight off the virus that causes COVID-19 disease. Sometimes this process can cause symptoms such as fever or malaise, but those symptoms are normal and usually very short-lived, and a good sign that your immune system is ramping up when you come into contact with COVID-19, you'll be protected. Is one of the COVID-19 vaccines better and safer than the others? The Center for Disease Control does not recommend one vaccine over another unless you fall into certain age categories. All COVID-19 vaccines currently available in the United States are effective at preventing COVID-19 as seen in the clinical trials. The best COVID-19 vaccine is the one that you qualify for and that you have access to. All currently authorized and recommended COVID-19 vaccines are safe, are effective, and reduce your risk of severe illness. The exception, of course, is for children. So as of July 2021, the only COVID-19 vaccine available to minors ages 12 to 17 in the US is the Pfizer vaccine. Moderna has asked for its vaccine to be authorized for this younger population and is currently ongoing trials and studies to make sure that it is safe. Does the COVID-19 vaccine change your DNA? This is a no. COVID-19 vaccines are a new type of vaccine called an mRNA vaccine, which protect against the COVID-19 virus. Many vaccines put a weakened or inactivated germ into our bodies to trigger a response. But in the case of the COVID-19 vaccines, these mRNA vaccines just teach our cells how to make a protein, or even just a piece of a protein, that triggers an immune response inside our bodies to fight a specific virus when we see it. The mRNA never enters the nucleus, or the home of our genetic material, our DNA, that's deep, deep inside of our cells. As the cell breaks down and gets rid of the mRNA goes away forever. It doesn't hang around. It's not part of your DNA after you get the vaccine. If people have additional questions about COVID-19 vaccine, who should they talk to? If you have additional questions about the COVID-19 vaccine, I recommend you start by discussing them with your primary healthcare provider. If you don't have a primary healthcare provider, you can search for local healthcare providers who are offering the COVID-19 vaccine and may be able to address your concerns. You can also find the latest information on COVID-19 and the COVID-19 vaccines at www.cdc.gov.